You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, Extreme Smile Makeovers, what my first guest calls full mouth reconstruction. He says your smile is never too bad, your gums are never too bad to have the smile you've always wanted. With us, we have an expert on this topic, Dr. Mike Pham. Dr. Pham, welcome to the program.
Oh, thanks for having me, Randy.
Now, good. Now, you have offices spread all over Texas, it seems like.
Yes, I do. I have some in Waco near Austin, some in Dallas, Fort Worth. They're all within this, nice 100-mile radius.
Now, for people that don't know your practice, who's the typical patient that you see?
My typical patient are people who haven't seen a dentist for years, and they're all of a sudden realize one day they're not happy with their teeth, they're not happy with their smile, or they're always in pain, they can't chew. And the typical patients are patients who aren't rich, they're just middle income, low income people who needs help with their teeth.
Now, the name of your practice, Affordable Dentistry Near Me.
Yes.
Because you do like in-house financing for your procedures, no matter how bad your credit is.
Right, no matter how bad.
With a down payment.
Right, with a down payment, like 20% of down payment. And we just in-house finance people who can't even afford it. So even if they want like a new smile and they got declined by, banks because they don't have great credit, because when you go to the bank or when you go to most dental office, they say, hey, if you don't have perfect credit score or if you don't have a lot of money, then you can't get your dental work. But we will in-house finance them to help them out because we want to help as many people as we can.
Okay, good. Now you do a lot of, we're going to get into the full mouth reconstruction topic in just a moment, but you do a lot of dental implant dentistry. Who's the typical dental implant patient?
Well, we have two types of dental implant patients. One of them are the people with loose teeth, bleeding gums, and they're heading towards losing all their teeth.
Okay.
And what we do for them is we give them a new set of smile, new set of teeth. Okay.
All right.
The other type of patients are denture wearers who they can't eat, they can't chew, they can't taste because they have something on the top of their palate that just covers all their food, right? And what we do for them is they come to us, and by that afternoon, if they come in the morning, the next day, or that afternoon, we give them a new set of teeth.
So moving on to today's topic, full mouth reconstruction. So give us a working definition. What does that mean?
It basically means you're losing some teeth, and then we need to give you some new teeth, either through single dental implants or veneers or bridges to restore your smile to where it was when you were younger.
You say losing teeth sometimes is very expensive. Elaborate.
Well, when you're losing teeth, it costs more money to put new teeth in. Sometimes if you don't replace those missing teeth, you end up losing more teeth, which means you have to replace more teeth. So like a lot of times you lose one tooth, people think they only lose one tooth, but they end up losing like 2 or 3 because of that. So it's always better and cheaper to try to save as much of your teeth as possible.
So help me understand, if you're only missing one tooth, why a dental implant over a traditional bridge?
You know what the problem?
They've been around forever.
They've been around forever, but you know what the problem with the bridge is?
What?
Randy? I gotta file your good teeth down, and then I gotta damage those teeth. And you know what other dentists don't tell you? Every 5 to 10 years, we gotta replace that bridge.
Okay.
So it ends up costing a lot more money. Well, with a dental implant, I just gotta replace that one tooth.
How long could that last?
In your lifetime. Because,
Is that right?
yes.
Is the implant a lot more expensive?
Well, no, it's definitely less because in the long run, you're only doing it one time as opposed to doing it every 5 to 10 years.
But even the initial upfront cost is about the same.
Yeah, it's about the same initial cost.
Now we talk about financing, but because look, even the best dental insurance only covers a very small portion, like of dental implants or some of this full mouth reconstruction stuff. And Medicare, Medicaid doesn't cover it at all. So what's the answer there?
Is being able to put everything on a monthly payment, even if you have bad credit, because not everyone has good credit on it. And I know insurance only covers a very tiny amount. So usually for the remaining amount, what we have is we have an in-office payment plan where you can just do monthly payments on that.
And get that done. Do people do that a lot?
People are.
So like every day they're financing?
Yeah,
stuff?
they're $100, $200 a month for their teeth, and they're very happy about that.
Okay. Now you say that when you take somebody with really bad teeth,
right,
and you give them upgrade their smile with a combination of procedures, that it's life-changing.
Right, because without your teeth, you don't realize it until you don't have teeth, right?
Okay.
And some patients, one of the patients I have, he was never able to eat steak. he wanted to eat a corn on the cob without taking all the corns off and eating with a spoon, right?
Okay.
So once we took out his bad teeth and gave him his new teeth, he can eat that steak and he eat that corn without peeling it off. I had this one patient. He's in his 30s. His confidence wasn't very high. He couldn't smile. He was embarrassed going into a social setting. He had difficulty dating because he couldn't talk because he always covers his mouth and people.
They tell you this on the consult?
Yeah.
Okay.
And they're not. These people they're handsome people, but because of their teeth, their facial expression is not the same, right?
Okay.
They don't have that self-confidence. So with this guy, what we did was we gave him a new set of smile, and he's all over. He's just talking to everybody. He's on Tinder now. He's all over the place.
Is that
He's
right?
getting
Okay.
dates. Yeah.
Now, when you say when they see the mirror, like their new teeth, their new
Right.
smile for the first time, that they get emotional.
Some people, they cry because they realize that this is who they are and they're able to finally express themselves. And some people are so happy that they can finally chew the food that they like, or they can finally taste the food that they haven't been able to eat for all these years.
So these extreme smile makeovers, like the full mouth reconstruction, are they also like in their 50s, 60s, 70s?
So, we have 50, 60-year-old women who when they go to church, they're not confident, right? They don't have teeth. They can't go, they can't sing because they have a partial in their mouth that's preventing them to be themselves at the church. So I have this one patient, once I gave her a new set of teeth, she's like, oh my God, I can smile, I can talk again. And being able to do it where she can afford it really changed her life because she went through several dentists who said, hey, I need all this money up front. And your credit wasn't perfect, so we just can't work on you.
So like $200 a month, you could get possible to get a whole brand new,
$200 to $300.
a makeover
Yes.
with combination of procedures.
Yep.
Do you do a lot of veneers?
Yes, I do.
You also make dentures too. We haven't talked about that. Even though I know you like implants supported stuff, but you also make cosmetic dentures.
Right. So we make our dentures in-house. And the great thing is a lot of places when they make dentures, they just use stock teeth and they just pick teeth and put it in your mouth. We customize our dentures to fit your mouth because we have a 3D printer that is customized to make for your teeth and your face.
Now you're a dentist. You probably think like the smile's the most important thing. How important is the smile in your opinion?
Well, we're always covered up, right? We have clothes on, but the smile, everyone sees a smile, right?
Okay.
The first impression that you get of another person is their smile. When you go for a job interview, the first thing that person sees is you smiling. Now, if you don't have teeth or your teeth are rotten or your teeth are bleeding and they smell, you're gonna not have that self-confidence that you need to get that job or get that promotion. So let me give you a story, Randy. There's two twins. One, her teeth is perfect, and the other one, her teeth isn't perfect. They're rotten, they're bleeding, and she doesn't have the confidence to talk at her interview. Who do you think they're gonna hire? The person who has charisma, who's laughing, who's talking, or the person who's shy? Because the first impression of that shy person or the person who's not outgoing is they don't know their stuff, right? So usually the person with the better teeth will get the better job.
You say people with bad teeth are judged.
Right. So people with bad teeth, people have a misconception of you're dirty, you're poor, you're not smart, even though may not be true, but that's people's perception of it.
Okay.
And like if you look at Hollywood, the villains are always bad teeth, ugly teeth, broken teeth, or missing tooth, and the superstars, the heroes, they always have perfect teeth, perfect white teeth.
Okay, good point.
So you can also look at people with missing front teeth. People think they look stupid, but they're not, right? And those are super easy fix, just like that. They come in one day, and the next day we'll give them new teeth there.
They can fix it.
Yes. I had this one patient. He got into an accident at his job, and a machine hit and broke his two teeth on the right. So now he's been out for several months without any teeth. And I asked him, you didn't have teeth for a couple months. Why all of a sudden you came and see me today? He was like, well, I found out about you because I've been saving my money. I've never heard of a dentist taking monthly payments. I was trying to save thousands of dollars because I know it's gonna be expensive. If I knew that I could pay a couple $100 a month, I would have just came to you first a couple months ago instead of being embarrassed for all these months just waiting to come see you. So I had this one lady, she was about to go on a cruise, right? And she ate something and she broke literally this tooth off, and she came up to me and she's like, Dr. Pham, I'm about to go on a cruise, but I don't want to be taking pictures without this missing tooth right here.
Okay.
And I was like, well, what we can do is put a new tooth there for you. And what we did is we took it out, put a new implant there, and gave her a new tooth where she can eat and chew and be in pictures.
Okay.
And that happened literally in a day.
Okay. So what about people though, and we're talking about like these full mouth extreme makeovers, but what if you have bad gums, like bleeding gum, like periodontal disease? Can those people do this?
Yes. Well, what we need to do is clean up the gum infection first.
Okay.
To make your gums healthy. And then, people think that if they only miss one tooth, then they're only going to stay missing one tooth, right? But they don't realize that it's an avalanche effect. Once you lose this tooth, you end up losing the top tooth. You know why, Randy?
Why?
Because the top tooth starts sinking in because there's no tooth underneath.
So if you're missing a tooth way in the back, because we were talking at the break, that a lot of people are missing teeth in the back and do nothing.
Right.
Why is it a mistake to do nothing with those people?
Because what happens is your teeth will start moving and shifting, and then your bite is off, okay? And then if your bite is not correct, we're gonna end up losing other teeth too. And a lot of times you'll end up favoring like this side or the left side, one side, the other, and because you're chewing only on one side, you're gonna end up damaging that side and losing those teeth. And then if you're only missing your back teeth, the only teeth you have to chew on is your front teeth, right? And then what happens is your front teeth starts flaring out and they get loose.
Okay.
And then you end up losing your front teeth if you don't put some teeth in the back. So Randy, we had this one patient, she was missing all her back teeth and she was only chewing with her front teeth. And when she first came into me, she's like, oh, I have my front teeth. I don't need any teeth in the back. Well, I told her, if you want to keep your front teeth, we got to put in back teeth. Okay. She's like, why? All right. Because what happens is when you only chew on your front teeth, you damage them. So what I did for her is I gave her a couple implants in the back we put 2 bridges on both sides on implants, implant supported bridges. That way she can now chew in the back teeth and not put all this pressure on her front teeth.
So you believe in, like, for example, if you're going to get a bridge, it should be attached to something.
Yes.
Like an implant.
Yes.
Tell me why.
The reason why is if it's not attaching something, it just floats in the air. So every time you're eating on, let's say, a partial or something that's not attached to anything, it hurts your gums. And then you'll be coming back every couple of weeks. Oh, I need an adjustment here and there. So if it's attached, you can eat whatever you want. So Randy, I had another patient. He lost all his front teeth, and he was afraid about losing all. He had an accident, so he was afraid about losing the rest of his teeth. He was worried about getting dentures. Okay. But luckily, or lucky for him, is we were able to put just 4 implants here and give him a new set of teeth in the front. So this guy, if he goes to a normal dentist who don't do implants, they would probably just give him a flipper that comes in and out. Or if they just do only dentures, they would have all his teeth removed, right? And after we gave him his implants and his crowns, he can chew and eat whatever he wants again, and not have to have that flipper that he came in with.
Now, what if you're just missing one tooth, like in the front? Can you match that up?
Yes.
Or is that difficult?
Yes. So doing a single tooth is very difficult. The reason why, because your teeth have so many different colors. There's literally millions of colors out there. So to get the perfect color is very difficult. So a lot of times if you're sitting it out somewhere, if you don't have your own house lab, you can't ever match it. Okay. So luckily what we do is we have our lab girls just walk over to you and match your shade right there to make sure it's a perfect color, instead of sitting it out to a lab or sitting it somewhere else and then you get it back and it's not the right shade. And then sometimes what some dentists do is they end up doing 2 crowns when you only really needed 1. Okay. And they end up doing, a lot of dentists will tell you to do 2 crowns because they can't color match it. But luckily at our office, we have multiple lab people who can come over and sit down with you and make sure you like the color. And then we bake that tooth to make it the perfect shade and make it stay on.
We're going to take a quick break. We come back, more about the process and sedation dentistry. You do a lot of this stuff while they're sedated. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
The problem that I had with my teeth is that it was very, very hard to eat. I would really work on trying to keep everything clean and sanitary, and it was just coming apart and things weren't doing well. And when you can't eat right, that really affects your health, and you lose energy, and you don't want to smile as much. You don't want to, because if you're missing teeth or the teeth are deteriorating to the point where when you smile, you're conscious of that, and you don't want to smile because you don't want people to see that. So I began investigating online about this implant technology and how it improves the condition of the teeth, how it improves your smile, and even the sanitary part too. And the cleanliness part was just a lot easier to go implants. And I can smile and go, hey. I can't sit and then sit there and go, oh, hey, put your hand over your mouth or kind of work your lip over it to try to hide something. You don't have to anymore, and it's great. They do feel like regular teeth. When everything is mounted in properly and everything is fit and formed, and you did a great job.
Thank you.
Fitting everything perfectly. I mean, there's really no, it feels like my original teeth like I had when I was younger, much, much younger. And these are actually a little stronger than enamel, which is the normal teeth material. And like you said, wow. I mean, now I feel like I could chew a rock. But don't do that. But I mean, they feel that good, and that's tight and strong.
Thank you for your time. Thanks.
Thank
awesome.
you. Thank you very much.
Man, thanks.
Hey, you're welcome.
Yeah.
You're welcome.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, Extreme Smile Makeovers. We're talking about full mouth reconstruction with Dr. Mike Pham. Dr. Pham, welcome back.
Thanks for having me.
Now, you are big on sedation dentistry. Like, who gets sedation? And what levels of sedation do you offer?
We offer all levels of sedation, and we offer it for people even if they just need a normal cleaning. Like, even if they come in every 6 months and they just want a cleaning. Some people, they just want that laughing gas. You know why, Randy?
Why?
Because that 1 hour cleaning will make them feel like 5-10 minutes. After we turn it off, they're just like, oh, it's all done. I myself, when I get a cleaning, I need to be on laughing gas because I just don't like the scraping or any of that noise.
And you come right out of it, right?
Yeah,
I mean,
you just come right out.
Put it on, you relax. I've had it. And once you get it, it's like the only way to go.
Right.
I tell my friends, I said, demand, but not all dentists even do nitrous. Is that right?
Yes.
Do you think that's insensitive?
That's crazy they don't do it. And I think the main reason why most dentists don't do it is because they don't have it in every room. At our practice, we have nitrous plumbed in every room, so it's quick, 5 minutes, like 2 minutes to put it on. Most dentists, they'll have to bring a little big old cart into the room, or if they have it at all. Some of them don't even have it. But all our rooms, they have nitrous, so that if you're getting a cleaning, you want nitrous, we just put it on like that. So for other patients who need like root canals, a couple extractions, these appointments, what would take 6 months, we can get it done in a couple hours with sedation. What we do is we give them a pill.
Okay.
And actually, they bring the pill to the office and we administer it. And then, it's very, very safe, Randy. A lot of people, they're very nervous about, being sedated, but we put them on a heart rate monitor. We put airway in on their nose, making sure they're super safe. And having you sedated or having the patient sedated, we can get that 6 month worth of work in a couple hours. You know why?
Why?
Because they're not fighting me. They're not yelling and fighting me because
they're relaxed.
They're relaxed. I mean, a lot of times
it must be easier for you to do your work.
Oh, it's like heaven when they're asleep. Okay. But when they're not asleep, when they're anxious or they're nervous, and they're not being sedated, I don't know how dentists do this because it's crazy. They're just yelling at the patient, and you can't work on the patients when they're like crying in pain or they're just moving around all the time.
That goes on.
It goes on, but when they're sedated, they're very relaxed, very calm. It allows me to do my work faster.
So some of these patients, you said that they're so phobic about the dentist that you have to give them a pill the night before just so they could sleep before their appointment.
Right.
Really?
Yeah, some people, they're so nervous, they can't sleep. They haven't slept for hours and they have to come to the office and some of them haven't seen the dentist for years because the thought of stepping their foot into my door terrorize them. It makes their blood pressure skyrocket, right? So we have to give them a pill the night before and then another pill when they get to the office. And with the pill, we can do extractions, we can take out their teeth, give them a new set of dentures, give them dentures, give them veneers, all while they're relaxed with the pill.
Okay. What's the next level up of sedation? Because I know you're big on IV sedation.
The next level up is putting an IV sedation putting an IV into them and just giving them the medicine. The reason why that's better is because we can tailor-made the medicine for them. It goes into the system better. With a pill, it's pretty much one pill for everybody, or one or two pills. But with the IV, it's very customized for that particular patient.
You can pull them out of it as well?
Yes, and we can pull them out at anytime.
So you monitor what? Like,
we're monitoring their heart rate, their blood pressure, in real time, actually. So with IV sedation, what we do is actually we give you a pill and then we put an IV line in you. So, a procedure that may take 3 to 4 hours will feel about 30 minutes to you.
Yeah, because you can't keep your mouth open for that long, it seems like.
It's hard enough to keep your mouth open for like 10, 15 minutes for a cleaning.
Yeah.
And then a lot of times when these patients wake up, they're like, "Oh, you're done, doctor? How long has it been?" Because the medicine that we give them helps them forget everything. So that's a really nice thing about IV sedation is they don't remember it. They wake up, they have a new set of teeth, and they don't realize how long they were there for.
We're going to take a break. We'll be right back. You're watching the Wellness Hour, news that makes you healthier. We'll be right back.
It was embarrassing. I didn't want to smile. I was learning how to smile with my lips, covering my top teeth.
Okay.
It's hard to eat. Your mouth's important, so it's appearance, People think you're a good-looking person until you smile, and you're not anymore,
Right, so it affected your confidence a lot?
Absolutely.
Okay.
It's life-changing. It was getting worse and worse, and I just didn't want to be one of those ugly people, so it's just, and then the eating also, it was just getting hard to eat. I had like one tooth I could chomp on,
Right.
Like there was only one tooth up top that would hit the bottom teeth, and then the ones that were up there were already rotting out, it was horrible, man. Everything is amazing, you did a great job, it's life-changing. 2 days later, younger guy, he was like, "How did you get such pretty white teeth?" So
Awesome. Hey, thanks, buddy.
Awesome, man.
Yeah. I'll see you soon.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, full mouth reconstruction. According to Dr. Pham, your teeth are never too far gone to have the smile you've always wanted. So with this full mouth crowd, bleeding gums, bad breath, loose teeth, but they're not quite ready for a full mouth of extractions. It's like a combination of implants and this and that. What do they call it? Do they just say, did they all think they're going to end up in dentures?
Sometimes, yeah.
On the consult?
But sometimes I can save them. I can save their teeth. So sometimes we just have to take out 1 or 2 teeth and give them a new teeth there, and it makes a big difference in your smile. We don't always have to take out every single tooth that the person has. Well, I did have a patient. He actually went to another center. I'm not going to mention the names, where they recommended to have all his teeth removed.
Okay.
But he wanted a second opinion, so he came and see me and met me. And he was like, "Dr. Pham, do I really have to take out all my teeth? I kind of want to save as much as I possibly can." I was like, "No, why don't we just take out the really bad ones and then put 2 or 3 implants, and then you can eat and chew again. We don't need to take out all your teeth if you still have 10 more years or 15 more years with your teeth, unless you want to. But typically, if you don't want to take out all your teeth and you have 10, 15 years down the road, we can then take out those teeth then."
Okay. Now, and by the way, back to sedation. Is it true that probably less than 10% of all general dentists even do IV sedation?
Yes, that's true. Most general dentists, they get very nervous about, they don't want to take the extra schooling. They don't want to take the extra.
Because you have to leave your practice and learn it somewhere.
Yeah, you have to leave your practice. You have to close your practice down. Bring your staff over. Leave for about 2 weeks, and then take all these hours just to learn to put people to sleep. And a lot of dentists don't want to take the time to do that. Technically, they're not asleep, so they're sedated. Where if I, grab your hand, I say, "Randy," you can wake up. Right?
Okay.
So you're not asleep. You're just more super relaxed.
So there's no way you'd be able to do what you do with these complex, with extractions and veneers and dental implants, to be able to do it without sedation.
No, because they'll be fighting.
What's the oldest patients that are coming in that they're not quite ready for dentures, but you have to maybe extract some, give them implants? How old are some of these patients?
Some of these patients who they came in, they think they need dentures. They're like 70, 80 years old, but we can still save their teeth and, take out 1 or 2 teeth, put an implant there, and keep their natural teeth for another 10 years or 5 years or 15 years, as long as they're coming in for their cleaning. So
people in their 80s are doing this all the time.
Yeah.
70s.
Yeah, you know why?
Why?
Because a lot of times these 70-year-olds and 80-year-olds, they're having, they have these birthday parties with their grandkids. They want to be able to eat and chew. They don't want to not be able to chew. So I had this one patient. the reason why she wanted new set of teeth and a smile makeover, because her granddaughter said, when she didn't have her teeth, made fun of her, so she felt insecure, right? So once I gave her a new set of teeth, and she can't come in and out, she can eat at the birthday party, she has confidence going to her granddaughters and meeting granddaughter's birthday party to have to meet with the relatives and eat and chew with them, and because a lot of times they want to eat like fried chicken.
Okay.
And they can't eat fried chicken with dentures because it's just going to flop
So
in
we're
and out.
out of time. Final message. So somebody, they're not quite ready for dentures, to have a full mouth of extractions. They could save some of their teeth, and they have the bleeding gums, the bad breath. They're this full mouth reconstruction crowd. But they've heard what you had to say, but they're still afraid. They can't get themselves to go in and do something about it. They can't eat, they can't chew. What do you say to them? They're still afraid. Or they're worried about finances.
A lot of times people are worried about financing. They think, oh, it's too much money. But if you can afford a couple $100 a month to completely change your life, would that be something you want to spend? And you can say yes, then I would highly recommend that you come see us.
Okay. Look, we've had the show for 20 years, and I've been interviewing medical doctors and dentists for years, probably 500 plus dentists. And you're the only one so far that I've met that does this in-house financing. I know orthodontists seem to do a lot of it, but
Right.
to do the rest of the dental, and you're doing an in-house financing, so it's good.
Yes.
So now there's no more excuse.
Right. There's no more
do it.
excuse. Like if you're afraid, we can sedate you. If you don't have good, if you can't pay it all at once, we can finance you. Even if you don't have good credit, we can finance you on it. So there's really no excuse if things are holding you back from changing your life.
And your centers, I guess there's no such thing as a super specialist, but you kind of do everything right there.
Yes.
Right?
Yes.
Like root canals,
We do root canals,
ortho.
orthos, implants, we do
Veneers.
And the great thing about our centers or our offices is we can design your smile, show you the design, show you what it will look like before we even work on you.
How's that?
We use 3D imaging, and we put your photo in there with your teeth, and then we can actually make your teeth before we work on you to make sure you like it.
So they could see their teeth ahead of time.
Exactly.
Is it like a facial scanner or something?
It's a facial scanner, because a lot of people they're afraid coming in, like, how will my teeth look like afterwards, right? But we can give you the answer
good.
before we work on you.
So we're out of time. Now, if somebody wants to make an appointment, they go to your website. But you say that, because you have a big team of dentists.
Right.
And you say they all act like you, kind of, right?
And they're all
They
really
have the
nice.
philosophy.
They're all very nice. They're very friendly, and we handpick the best dentists that we believe that we out there.
Okay, good. Thanks again for coming on the show.
Thanks,
Good
Randy.
stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.